Bonsoir, dear viewers, and welcome to a new edition of our program, Africa Today. And in our program today, we are going to talk about the vaccination against the COVID-19 in Africa. But first, we'll start with this report where the Ministry of Water Resources and Irrigation said that Ethiopia's second filling of the Grand Ethiopian Renaissance Dam, expected in July, will affect Egypt and Sudan by all means. However, the effect will differ only depending on how far the two countries are well prepared to absorb these water shocks. More details with Samah al-Sharif.
In TV statements, the Ministry of Water Resources and Irrigation said that water shocks expected in Egypt during Ethiopia's second filling of the dam include drought, floods, and other cases that could affect water. Abdelati said Ethiopia's filling is a shock because it is a kind of artificial drought to both of Cairo and Khartoum, as Addis Ababa is planning to store 13 billion cubic meters of water. However, he explained that Cairo has been preparing infrastructure during the past 5 years to absorb this shock as far as possible to reduce negative consequences. Abdelati stressed that the second filling will pose a real threat to Sudan, explaining that Khartoum faced 3 problems last year as a result of Ethiopia's first filling. He said, firstly, it caused a drought, then a flood as a result of releasing water from the dam. He noted that the third problem was in November when Ethiopia opened the dam doors again without coordinating with Sudan and released an amount of silt that affected the drinking water. Conducting the second filling in July could result in one of 3 possible scenarios that could affect Egypt and Sudan, as he said. The first and second cases, he said, are for the flood level of the Nile River to be between high and medium during the filling, in which case the capacity of Egypt's infrastructure will absorb the shock. But he said the worst case would be conducting the filling during a natural drought for the Nile water, and this will cause Egypt severe harm.
The African Centers for Disease Control and Prevention, Africa CDC, said that the number of confirmed COVID-19 cases in Africa has exceeded 4,709,921. The figures came as the EU announced it is to invest 1 billion euros to build vaccine production hubs in Africa. More details.
The Africa CDC, the specialized healthcare agency of the 55-member African Union, said the death toll from the pandemic stands at 127,001, while 4,261,603 patients across the continent have recovered from the disease. South Africa, Morocco, Tunisia, Ethiopia, and Egypt are the countries with the most cases in the continent. According to the Africa CDC, South Africa has recorded 1,617,840 COVID-19 cases, the most among African countries. In terms of the number of cases, Southern Africa is the most affected region, followed by Northern Africa and Eastern Africa regions, while Central Africa is the least affected region in the continent. Meanwhile, the European Union said it will invest 1 billion euros to build vaccine manufacturing hubs in Africa. The statement was made by the head of the European Commission, Ursula von der Leyen, on Friday. The statement said the move is meant to make Africa more independent on vaccine production.
To shed more light on the issue of vaccination production for Africa, we are very much delighted to have with us over the phone Dr. Yousef Mazhar, our former Assistant Minister of Industry. Dr. Mazhar, good afternoon to you.
Good afternoon to you. How are you?
How are you, sir? Dr. Yousef, please can you tell us, the EU announced it is to invest 1 billion euros to build vaccine production hubs in Africa. Dr. Yousef, how do you see that step by the European Union in order to help Africa face the COVID-19?
Yes, well, of course, you know, this is a changing situation.
Yes.
With politicians on both sides, different schools of thought.
Yes.
But maybe we can analyze it a little bit because at the end it's supposed to be an industrial effort.
Yes.
Now, the vaccine at the beginning when it started, it was very difficult to make it anywhere except in the laboratories which sort of sorted it out.
Yes.
Or calculated it or discovered it. And it was very difficult to do anything more than that and to put it inside the special containers and special temperatures. Now it's become easier for people to manufacture with the know-how in another place apart from the place or the labs or the company that has started. And this you see how now there are going to be, even in Egypt now at the moment, we have got one very big plant coming up where we are going to assemble and partly manufacture the serum itself. So this transfer from just delivery or just sending things there with special conditions, you can start making, let's say, small steps towards producing. But it will come very slowly because to produce anything, a serum or anything or a medicine, is a different thing than to make anything mechanical or anything electrical. There are human lives at stake, there is safety, there is lots of precautions. But I think it is coming, and it will come because the amount and the quantities of Africa cannot be just delivery. You must try and start sending the material out and then slowly increasing the amount of things you do. Let's say, in Egypt here, the first 150 liters are coming in, or 150 equivalent of tons, and they will fill up all the vials. That means it's the packing, the last packing. Now you can start in Africa like this, and you have to be careful because you're going to transfer semi-finished things. And I think it will work, but it will work slowly. And of course, the big problem in all this is that the different schools of treatment, some you transport the material at minus 30 degrees at the beginning. It was very strange, and then they got better things. Then now the time between the first inoculation and the second is being maintained. I think it will come, but it has to be very careful to move the industry away from the laboratories out of the main countries into countries that have different levels of medical, let's say, medical industry. Some make aspirin, some make other kind of... The medical industry or the medicines industry exists in many African countries, but still it's rather at the beginning. But I think it's a good start, and if they go slowly, maybe that's how they can solve, because just deliveries everywhere, even the deliveries now through special agencies like COMEX, etc., that are sending to Africa through Europe, is slow. So the answer, of course, is producing in Africa, but means you have to have new hospitals, you have to have new production plants, you have to have different kinds of workers, tested people, and not only workers, you have to test. All the things that you do have to be tested. And they have to be tested in the country itself, in batches, you see. So the medical industry is a more sophisticated and very sensitive. But I think it will come. I don't think it will cover the whole of Africa. I don't think it will solve the problem. But I think it's a step in the right direction.
Indeed. Dr. Mazhar, how would such a move can impact the fight of the disease in the Black Continent?
Excuse me, I didn't get the question.
How can that move help in fighting the disease in Africa?
Well, I think Africa, you see, of course, always when we talk about Africa, people are liable to talk that Africa is one big continent. But Africa is West Africa, special characteristics, a lot of French influence, East Africa, a lot of former British, the middle of Africa, South Africa with its independence. So each one of those has its own politics, its own, whether it's economically rich or poor, whether the people are accepting, the people are in towns or they are out in the wild. It's a very big continent. It's a continent bigger than any other continent, And these things are so different. So
Yes.
the distribution system is one of the biggest problems in countries like this. You have all these things, even in the States, all outside the factory. But to get it to the consumer, and then from the consumer to the lab, and then from the lab to the
Yes.
treatment. You see in Egypt, even now we are turning the whole big areas like libraries, like exhibition areas, we're turning them into makeshift
Yes.
places. So this has to be done in Africa. So you have to change the level of cleanliness, level of perfection,
Indeed.
level of statistics. Don't forget
Yes.
that all these epidemics, you control them by statistics. You have to know who is ill and who is not ill, who is being cured or not. So you need a very strong statistics system.
Yes, indeed.
But I think,
yes.
you have to start, and as the problems come across, then you try and solve them.
Indeed.
And I hope that Egypt
Yes.
will have a role in all this, but we
Indeed.
should not think that we can solve Africa, because Africa is a very big continent.
Yes, yes. Also under the deal, Dr. Mazhar, the Chinese and the Russian vaccines are to be produced in Egypt. How soon do you expect the jabs to be available?
Yes, well, look, this is a good story, because I think the agreement was all industries, when you start agreeing, you start by bringing components, then you assemble them in the country, and then slowly you make parts of them more and more percentage of local industry. The same thing here, but it has to be difficult. We know, for example, that the first production of Chinese, let's say, serums, if we call them that at the moment, that the first shipments of ready mixed solutions, that means you start by packing them properly and testing them properly, and the next stage is to take individual components of this mixture, which sometimes comes from other countries, and mix them yourself inside. But that means you have to test them and make sure they're mixed properly. But they have started, and the first start in Vatsera is a very good example. It's an area which is well controlled. It has 2 large factories in Egypt, in both sides of the city, and they are used to making other kinds of medicines. I think it's a good chance. They've got skilled workers. They've got very careful sanitary, let's say, precautions. I think it's going to work very much. And also, you start by bringing not only the materials, but also the person. And we know that we have brought people, in the case of China, a whole group of people came with the first ready-made mixtures, and they are setting it up. Slowly, you reduce the number of experience working. You increase the number of suppliers, maybe not just from China. Maybe you can get some other countries that are supplying components. But you must go slower than a normal production, because it's human life.
Yes, indeed.
If it's a car, it breaks down, but if it's a medication, it can cause havoc.
Yes. Dr. Mazhar, how do you weigh actually the severity of the cases in the African continent during the 3rd wave of the pandemic?
Well, look, of course, I'm not the expert, but as an observer and seeing, I think there's a lot done about statistics. And of course, there are countries, especially in the Western world and also in Russia and China, where statistics are very exact. That means in China, because it's a very controlled country, everything that happens is exact. Also, Russia is the same thing. There's a system where you know exactly how many people were sick, how many people were cured, which areas, and they are making models. Models, mathematical models, saying that if let's say the maladies are more than so much percent, or the area is contaminated, you can make projections, mathematical projections. And these are the things that these politicians are working on. Politicians don't work exactly, they work on mathematical models. And so that's how they open and close That's why they put precautions and loosen them. For example, beaches, open the beaches.
Yes.
And even in Europe, I'll take something away from Egypt. When they opened during Easter abroad in Europe, the numbers statistically went up very high.
Indeed.
Because everybody went to the seashore, everybody, it was
Yes.
nice and weather, but
Yes.
the contamination, the rate became very big. If you don't have a very good statistical system with exact figures, daily figures, and everybody tells you exactly who is sick or who is not sick and who is cured, you won't be able to plan. You see, and the politicians would like, and people would like to open up. Why? Because if you don't open up, people won't be able to work. They won't have methods of income. They won't be able to exist unless with a government fund.
Indeed.
So you have to think that I can't keep closed all the time, which is better until you finish the epidemic. But you can't. People will not work. They will be unsatisfied. They have to help them financially. Economy goes down. That's why this fluctuation of open and close.
Indeed.
Open and close, you see?
Yes,
It's a difficult situation.
Yes, indeed, Dr. Yousef Mazhar, former Assistant Minister of Industry. Many thanks for your precious input, sir. And the historic drought caused by deforestation and the economic effects of the COVID-19 pandemic has plunged southern Madagascar into the region's worst nutritious crisis in decades. Some 74,000 children are acutely malnourished. More details.
Madagascar's worst drought in 40 years has left more than 1 million people facing hunger and the island country on the brink of a human rights crisis. Donors, foreign governments and regional leaders have therefore been urged to intervene. Tamara Liger, Amnesty International's Madagascar program advisor, said the rights of more than 1 million people are currently threatened in southern Madagascar, with thousands at risk of starvation and more than 1 million struggling to access sufficient quantities of food. Liger said the situation is dire and there is an immediate need for coordinated regional and global action to help avert what could easily become a human catastrophe. The United Nations Food and Agriculture Organization, FAO, and the World Food Programme, WFP, last week issued an urgent warning to draw international attention to the humanitarian crisis unfolding in southern Madagascar.
Well, with that, our dear viewers, we come to the end of our program Africa Today. Many thanks for watching.